There's a kind of pain you don't talk about at the dinner table. You don't mention it to your friends. You may not even tell your spouse. It happens in the bathroom. A sharp sting, maybe a streak of bright red blood on the tissue, and then a quiet worry that follows you around for the rest of the day. Is it just a small tear, or is it something worse? If that question has been sitting in the back of your mind for weeks, maybe months, I want you to take a breath. Because by the end of this video, you're going to know exactly how to tell the difference, what's quietly keeping it from healing, and what to start doing tonight to give your body real relief. Now here's why this matters more for us as we get older. After 50, the tissue in that area becomes thinner, drier, and slower to repair itself. Blood flow changes, bowel habits change, medications change, and a small fissure that would have healed in a few days when you were 30 can stick around for weeks, even months, in your 60s or 70s. That's why so many seniors end up stuck in a frustrating cycle. The pain comes back every time you go to the bathroom. The bleeding shows up again just when you thought it was finally better, and the longer it lingers, the louder that scary little voice gets in your head asking, what if this is something more? So let's talk about it honestly. No embarrassment, no medical jargon, just clear, useful information. An anal fissure is exactly what it sounds like. A tiny crack or split in the delicate skin right at the opening of the rectum. Imagine the corner of your lip cracking in dry winter weather. Now imagine that same kind of crack in a place that has to stretch every single time you have a bowel movement. That's why it hurts so much, and why it has such a hard time staying closed long enough to heal. The classic signs of a simple fissure are pretty specific. There's a sharp, almost knife-like pain during a bowel movement, then a burning, aching feeling that can last for minutes or even hours afterward. You might see bright red blood on the toilet paper or sitting on top of the stool, not mixed into it. And often there's a small itch or a feeling like something is raw down there. That's the typical picture. And honestly, most fissures, when treated kindly, heal on their own. But here's where it gets tricky for older adults. If you've been dealing with this for more than 6 to 8 weeks, something is interfering with the healing process. And in most cases, it's not because something sinister is going on. It's because of a few quiet daily habits that keep tearing the wound open just as it's trying to close. Let me walk you through them, because once you see them, you can fix them. The first one is hard, dry stools. After 50, many people don't drink enough water. Add in blood pressure pills, water pills, pain medications, iron supplements, or simply eating less fiber than you used to. And stools become firmer. Every time a hard stool passes, it pulls that healing crack right back open. It's like picking at a scab over and over again. The second one is straining. We don't always notice we're doing it. But sitting on the toilet, holding your breath, pushing hard, that pressure tears the tissue and starves the area of blood flow. And without good blood flow, no wound can close. The third one, and this surprises people, is sitting too long on the toilet. Reading the paper, scrolling the phone, taking your time. The shape of the toilet seat puts pressure exactly where the fissure is, and that pressure cuts off circulation to the very spot trying to heal. The fourth one is using rough or scented toilet paper or harsh soaps. That sensitive skin doesn't need perfume or scrubbing. It needs to be left alone. And the fifth one, which almost no one talks about, chronic tight muscles. The muscle around the anus, called the internal sphincter, often goes into spasm when there's a fissure. That spasm squeezes the area, blocks blood flow, and basically traps the wound in a can't-heal state. This is the single biggest reason fissures become chronic in seniors. So before we even talk about treatment, look at this list and ask yourself honestly, which of these am I doing? Now let's get to the question in the title, because not every pain down there is a fissure. And I want you to be able to read your own body with confidence. A simple fissure tends to follow a pattern. The pain is sharp and tied to bowel movements. The bleeding is bright red, small in amount, and only on the paper or surface of the stool. The discomfort settles between bathroom visits, and you can usually pinpoint exactly when it started, often after a bout of constipation, diarrhea, or a particularly hard stool. But there are other things that can feel similar, and you deserve to know them. Hemorrhoids can also bleed bright red, but the pain is usually a dull pressure or a swollen, lumpy feeling, not a sharp cut. Many people actually have both at the same time. An abscess, which is a pocket of infection, feels different. It's a deep throbbing pain that doesn't go away between bathroom visits. There may be swelling, warmth, fever, or a bump you can feel. That's something to take seriously and not wait on. A fistula is a small tunnel that forms after an old infection. It can leak fluid or pus, and the discomfort is more constant. And then there are the signs that doctors really want you to pay attention to, not to scare you, but because catching things early saves lives. Dark or black blood mixed into the stool, not just on the paper. Blood that looks like jelly or clots. A change in the shape of your stool, like it suddenly becomes pencil thin and stays that way. Unexplained weight loss. Ongoing fatigue or feeling weak. A constant feeling that you haven't fully emptied your bowels. Pain that has nothing to do with bathroom visits and is there all day. These signs don't mean something is definitely wrong, but they do mean stop guessing, make the appointment. Because the relief of just knowing is worth more than another month of worrying in silence. All right, let's say your symptoms sound like a simple fissure. What can you actually do? Here's a routine that respects your body and gives that little crack a real chance to close. Start with water, real water. Most seniors I talk to are getting maybe 4 or 5 glasses a day, and a lot of that is coffee or tea, which doesn't fully count. Aim for steady sips throughout the day until your urine is pale yellow. Soft stools begin in the kitchen, not the bathroom. Next, add gentle fiber, not a giant scoop of harsh fiber powder that leaves you bloated. Think cooked oats in the morning, a pear or a few prunes in the afternoon, a handful of ground flaxseed sprinkled on yogurt, cooked vegetables at dinner. If your doctor has approved psyllium husk, start with a small amount and build up slowly with plenty of water. The goal is stools that pass without effort, soft, formed, easy. Then change how you sit on the toilet. Place a small footstool under your feet so your knees come up higher than your hips. This straightens the angle of your colon and lets stool come out without you pushing. It's one of the simplest changes you can make, and it works. Limit your bathroom time to a few minutes. If nothing's happening, get up and try again later. Don't sit and read. Don't scroll. That long pressure is one of the main reasons fissures don't heal. Now, the part that brings real relief. Sitz baths. Fill a clean tub or basin with warm, not hot water. Sit in it for about 10 to 15 minutes, 2 or 3 times a day, and especially after a bowel movement. The warm water relaxes that tight sphincter muscle we talked about, and when the muscle finally relaxes, blood flow returns and healing can actually begin. Many people feel noticeable relief from the very first sitz bath. After bathing, gently pat the area dry. Don't rub. And switch to unscented, alcohol-free wipes or just plain water for cleaning. Your skin will thank you. If your doctor agrees, a small amount of plain petroleum jelly or a recommended barrier ointment at the opening can protect the area between bowel movements. There are also prescription creams, usually containing nitroglycerin or a calcium channel blocker, that specifically relax the sphincter muscle and dramatically improve healing in stubborn fissures. If home steps haven't worked in a few weeks, ask about these. And finally, move. A short walk, even just 10 or 15 minutes a couple of times a day, improves circulation to the entire pelvic area and gently keeps your bowels regular. You don't need a gym, you just need to keep your blood moving. This kind of routine helps almost anyone, but it's especially powerful for 3 groups. First, people who get constipated easily because of medications. Second, people with diabetes, where slower healing makes every small wound a longer project. And third, anyone who has had this on and off for years and assumed they just had to live with it. You don't. I want to be honest with you about expectations, though. A fresh fissure can heal in 2 to 4 weeks with these changes. A chronic one, meaning it's been there longer than 2 months, usually takes longer, sometimes 6 to 12 weeks, and may need a prescription cream to fully close. That's not failure, that's just the slower pace of older tissue. Patience with your body is part of the medicine. Here's where I want to be very clear with you. Please don't stay home with this forever. See a doctor if the bleeding is heavy, dark, or happening between bowel movements. If pain is constant, deep, and not tied to the bathroom. If you feel a lump, swelling, or warmth. If you have a fever. If your bowel habits have changed in ways you can't explain. If you've been losing weight without trying. Or if 6 to 8 weeks of careful home care hasn't moved the needle. A simple exam, often just a careful look, can give you an answer in minutes. And in the rare case it's something more, catching it now is the best gift you can give your future self. Most of the time, though, you'll walk out of that office with reassurance and a clear plan. And that peace of mind is worth far more than the courage it takes to make the call. So, coming back to the question we started with, is it just a fissure or something more serious? Most of the time, it really is just a fissure, a small stubborn crack that's been kept open by hard stools, tight muscles, long bathroom visits, and the natural changes that come with age. And most of the time, it can heal, quietly, gently, at home, when you stop fighting your body and start working with it. But your job isn't to diagnose yourself perfectly. Your job is to listen, to notice the patterns, to make the simple changes that give your body a fair chance, and to know clearly when something deserves a closer look from a professional. You're not weak for having this problem. You're not alone in it, even though it feels that way. Bodies wear, tissues thin, and healing slows. That's part of being human at this stage of life. What matters is that you're paying attention, and that already puts you ahead. If this helped clear up something you've been quietly worried about, do me one small favor. Share it with one friend who might be suffering in silence. They may never bring it up themselves, but a video like this could be the nudge they needed. And if you'd like more honest, practical health talks made for those of us in our 60s, 70s, and beyond, the kind that treat you like a grown adult and not a statistic, go ahead and subscribe. I'll see you in the next one. Take gentle care of yourself today.